My first question to you will be, tell us how you see life sciences and technology walking hand in hand, not only today, but even into the future.
Yeah. So I think great question, Chantam. First of all, let's understand the whole purpose, why we are doing what we are doing. We want to be cost effective. We want to make sure that our products are out there in the shelves and we are able to meet unmet needs of the patients, right? So that is the reason why all these pharmaceutical companies exist today. From an Indian subcontinent perspective, I think we are the pharmacy of the world. Now, if at all we are the pharmacy of the world, we should be efficient in what we are doing, and we should also be able to scale our operations as much as possible. Both scale and efficiency will not be possible without digital. Yeah, that is the first and foremost thing. So, if you look at the broader perspective of how digital has created an impact in the way we look at pharmaceutical operations today, is broadly, if you look at it, so suppose 43% the cost 1,000 pills is actually decreased. Yeah. And this cost is not only incurred by the pharmaceutical company, it was also incurred by the patient who was actually consuming it. We are seeing around 26% reduction in terms of rejections. In terms of overall logistics cost, it has come down by 27% because we are able to intelligently plan that if I send it through a sea shipment, I'll be able to save cost, but at the same time I'll be able to deliver it on time, right? On time in full. It's very, very important. Around 76% quality deviations have come down. When I say deviations, this could be out of scope, out of trend, or whatever OS, OTs we call in pharmaceutical space. Productivity, if you look at it, has increased by 43% in a pharmaceutical plant because we are able to do the same operations in much, much lesser time, and it's very, very cost effective way.